Hey there, hey, Carmen here. I kind of have my voice back, so this should be a little bit more fun this week because I won't be struggling or squeaking. If you have not met me before, my name is Carmen. I am a myofunctional therapist, and I also say I'm an educator extraordinaire because I spend a ton of time doing this. So helping my community, helping my tribe be their best self because they are understanding their myofunctional issues. So my new blog came out this morning and it was all about healing and recovery expectations. And I think this is probably going to be a pretty popular one. The reason I say that is because this is probably one of the more unknowns. I probably answer 2 dozen, 3 dozen emails every week of people saying, hey, you don't know me. I had a frenectomy done. I wasn't prepared. Nobody went over this stuff with me. Can you help me? Because I'm really disappointed. I'm frustrated. I'm deflated. You know, lots and lots of emotions come into that when you go through something that you're just flying by the seat of your pants, frankly, and you start to be concerned that it's not going to go right. So I think that's why this is going to be so popular. So what we're going to be talking about today is I'm going to be going a little bit deeper than what I talked about in my blog, and I'm going to be demonstrating really or showing you what I know. So let me just brush up on what I touched on in the blog so it makes sense as I build on that here. Let me have a sip, since I am still struggling a little bit. So in the blog today, I touched on a couple things. So don't judge the wound by the size of the wound. So don't judge the procedure, I guess, by the size of the wound. I say that, but you guys, this is serious business. It is so disheartening when my clients send me a picture and it looks like they have a canker sore, okay? So there are situations where I would bet the farm on the effectiveness of the release, as in it stinks. But sometimes we can work through that. So I don't want that to be the only thing that you're judging the success of the procedure on is the size of the wound. So we talked about that. I talked about primary intention versus secondary intention. So we want you to heal by primary or by secondary intention, really, unless you have stitches. And stitches is not something, goodness, I can't even talk today. Stitches is not something I talked about in the blog. So if you're wondering about that, then you want to come back to me. No multitasking. Be right here and hear about that because we're going to talk about stitches in just a sec. But that primary versus secondary intention, how the healing is very, very important because you want it to heal from the outside edges in. So this way, not this way. So if you want more about that, then you should check out the blog because I really go into great detail with that. And then we talk about that the doctor should give you the instructions, okay? This is the doctor's wound. They created it. They need to tell you how to take care of it. Now, I'm going to go out on a limb here and share with you the things that I know. And I know this stuff not because I've had a frenectomy or not because I should really be talking with you about it, but because I've witnessed it. And I went through it with my sweet granddaughter. So I am going to share with you what I know she did as far as her active wound management. So before I jump into that, let's talk about stitches. So I didn't touch on it in the blog, like I said. Stitches are something really that the provider is going to decide. I have seen the gamut. So I've seen them with laser and stitches, with laser, no stitches, and then, you know, the scalpel where the traditional where they cut and then stitch. Okay. This really is going to be their decision. So you're more concerned about the provider and their knowledge rather than what their method is. Okay. Now, clients will ask me, so Carm, what's your preference? What makes it easier for you? What makes it harder for you? So when I have clients that have stitches, I'm not going to lie, it is harder for me because there's these stitches in there that are preventing how much movement we can get out of the tongue, really. I had a client once who was so stinking excited about the freedom that she felt with her tongue that she promptly went with her tongue and popped out all of her stitches, okay? So here's what I think it probably feels like with those stitches. Like, when you have those pants that are just a little bit too tight, and if you bend over, you think you're going to split the butt of them open. That's what I feel like it probably is like with stitches in the tongue. So I'm trying to get my clients to move their tongue around, and they have this obstacle in there, these stitches, which makes that difficult. Not to mention, sometimes the provider says, don't move your tongue. And I'm saying, yes, move your tongue. You need some functional movement. And so we have to really marry the two and find a balance. So when I have clients that have stitches, as with all of my clients, I meet with them within 48 hours of their frenectomy. So we can talk about the procedure. We can talk about where we're going from here. Everybody likes to know where they're at and where they're going to go. Nobody likes to just be on a wild goose chase. So I'm always talking about that with my clients. Here we are. Here's where we're headed. But at that appointment within 48 hours right after the frenectomy, we're talking about what to do, how to take care of it. Because if you got my email this morning, if you're a subscriber of mine and you got this is the time where you cannot half-ass it. You cannot screw things up. You cannot screw up. You do not want to screw up the healing process. So this time is so important. For me, it's the most important time with the correct pre-procedure therapy coming in a close second, okay? So I'm very, very passionate about meeting with my clients right after their frenectomy so I can guide them. So I can do what they're paying me to do. So when somebody has stitches, that it kind of prevents them being able to jump right in and do their exercises. So when I have a client who has stitches, I say you have to find a balance where you can start moving that tongue, getting it moving, but you can't blow the stitches out of there, okay? So for even a few days, you have to really be delicate there while moving the tongue. So I kind of argue sometimes with some providers when they say, nope, leave your tongue lay. And I tell them, nope, move your tongue around at least a little bit. Okay. And so stitches, they do heal by primary intention because you bring the sides of the wound together so that intention is different. But what those stitches are doing is preventing it from really healing down on top of each other. So really, if I have an adult who is going to take care of their wound, then I love them not to have stitches, but sometimes they don't get a say in that. So I don't like to have, to give a lot of guidance on that because I do not want anybody to go to their doctor and say, well, I know you do it this way and you do stitches and Carmi Cat said it goes this way, and so I never want it to be like that. I want it to be, I want my clients to feel confident going into the procedure. So we prepare each way. And so that really sums up stitches. I think I touched on everything with that. So let's just go away from stitches now. So in somebody who has that gaping wound, and by gaping, I'm pretty certain it should be gaping. So it's more of a diamond. And the active wound management is very important because you want that secondary intention. So you want it to heal slowly from the outside in, not like this. And so the mouth is amazing and it wants to heal in a big hurry. So I do always tell my clients, hey, this is your doctor's wound. He gave it to you or she gave it to you. They need to tell you how to take care of it. But really, when it all boils down, I work for my clients. I advocate for my clients. And the last thing I'm ever going to do is turn my cheek and say, nope, that's not my area. So, but I do always tell them that, like, if it heals wrong, I want it to be your doctor's problem, not mine. But here's what I know and here's what I will tell you. So a couple of the things that I know that my granddaughter did. So my daughter would, of course, you're going to wash your hands. Some people like to do gloves. That's fine. I'm going to show you, I'm not going to stick my fingers in my mouth while I'm talking to you here. So the first one, I like to call it like the rolling pin. So I say, get your guns out and you're going to get in and you're going to roller pin and just kind of work that tissue. Now you don't need to get all Western here. Okay, so if you do too much, then you're going to cause tissue trauma. So we don't want that. But you want to get in there and work that tissue. The next movement that my daughter did was to take her finger and go this direction, opposite of the wound. So back and forth there. That is going to help break up that wound a little bit. I know that sounds absolutely barbaric, but that's how you get that secondary intention healing, which is what we want, okay? Next, we call it the forklift. So with a child, you want to get under there, and this is for an adult as well. You want to get under and lift, but I don't want you lifting at the front of the tongue, okay? So you got to get under and lift and get deep and lift. Now, that really, other great providers that give really good guidance, they're going to give you kind of a combination of stretches and some exercises. I have a lot of clients that come to me from great providers, and their provider says, okay, you do what I'm telling you to do until Carmen gets a hold of you, and then you do what she tells you to do. So never am I going to pile everything on top of what the doctor said. But those moves, the rolling pin kind of going this way, and then the forklift is really essential and super duper important. Now let's talk about a couple other things. So a lot of people like to do a lubrication. I will give you no opinion on this, and here's why. Because there's so many different opinions out there, and I don't know. I'm not the expert. Some people like to use oil. Some people like to use vitamin E. Some like to use coconut oil. And there's conflicting reports on if that causes you to heal faster. So I do not give my clients an opinion on that. I refer them back to the doctor. That person can tell them, or they can do their research or whatever. I'm not Dr. Google, so I don't want to put that out there in the universe. One thing I will tell you to do is I want you to drink a lot. I want you to be hydrated. And by drink a lot, I mean water, tea, non-caffeinated beverages, that kind of stuff. Because we, all throughout our body, we heal better, we function better with more hydration. And I want you to control the inflammation. So if you have a high inflammatory diet, you're going to have a lot of inflammation. So I encourage my clients to think about that kind of stuff as they're going through this process. Next, I want to touch on here real quick, how long, how often. So I tell my clients, like I said, don't get all Western here. I mean, sometimes these wounds are going to bleed, and that's okay. No more bleeding than what you would get from a healthy mouth of flossing. Okay, so hemorrhaging, not what we're talking about, but a little bit of blood, totally normal. Remember, you're disrupting a wound. But I don't want you to think, well, if a little is good as a lot's better. So I want you to do the minimum amount for the minimum amount of time so that it's effective, okay? With children, a lot of my clients are itty bitties. They're little kiddos. And I have parents start working in their mouth before they have their frenectomy, so the kid knows what this movement is that mom or dad's doing, what this is going to feel like, what it feels like when they do, the forklift. Let the kid get used to the parents being in the mouth. That really helps. They talk about it. That way the kid's not blindsided and they're not overwhelmed. They can do this because they've been practicing it, okay? So I think those are really, really important. Healing and recovery, like I said, from a frenectomy is, bar none, so important, because there's a lot of things that we can recover from that I can help my clients recover from. For example, if I have somebody who's in therapy with me for 8 or 12 sessions and they get sick or the kids get sick or something, I can help them recover from not doing a great job on their exercises, on their myofunctional therapy, but I can't help them recover from a crappy job healing. So we really have to get that perfect. And I have some clients where we're waiting for the teenager to cooperate before we do the frenectomy, because you can't just go into it blinded and say, well, we're just going to fly by the seat of our pants here because it's not good. So we wait for those kids to cooperate before we move on. Okay, so that is going to wrap it up, guys. I went a little bit longer than I normally do, but I feel like it warranted it because it's super important. Next week, I am going to be talking about really a time commitment. So the topic is going to be, will you be a slave to your myofunctional homework? Because a lot of people get concerned about that. And then I want to go over a couple things here. So if you look here, this is on my Facebook page. This is our extra special April Loves for our kiddos. So 20% off the mini Myo program saves almost $200. This is huge. This is a great time to be thinking about your kiddo. If your kid's going to start therapy, summertime is a great time to do that. Now, they have to have an exam first, but the mini Myo program, we meet once a month for a year, and we do all things Myo, but it's definitely customized for your kiddo. It's game-based, and this is great if you have more than one kiddo who needs myofunctional therapy, but maybe they're too young. You're going to learn, as a parent, you're going to learn so many things that you can bring to the table. So that is through this month. You can find that offer on our Facebook page. And then last, my quick assessment tool. So many of you, and judging by the size of how my subscriber list is growing, a lot of you guys, you download this quick assessment tool so that you can screen yourself before contacting me. And I absolutely love that, because it means that you get it. The light bulb has come on. You see some value in what I do as a profession, so it's a great tool. This quick assessment tool you can get at the bottom of any one of my blogs. So that's myofunctionaltherapy4u.com, and that's the number 4, the letter U, and forward blog. So at the bottom of any one of those. What you're going to do when you get this tool is you're going to take yourself through the paces. There's 25 questions. There's an adult, there's a child. Go through these questions, see if you have concerns, because if you're like a majority of the people who come to me for therapy, you have no idea that any of these are a concern, okay? It could be something as simple as you snore, you mouth breathe, all of these things you might think is just totally normal, but it's not. It's a myofunctional impairment. So you can get this assessment tool, download it, use it, take yourself through all the questions, and then that's going to help you determine if you need to reach out to somebody like me, okay? So that is it. I'm going to let you guys get out of here. Have a glorious day. Please find us on YouTube. You can also join my myofunctional therapy support group. That is the tongue tie and myofunctional therapy support group, kind of a mouthful. You can like us here. You can find us on Instagram. We're a lot of places, and we are here to educate and serve you. So I thank you so much, and I will see you next week, where we're going to be talking about whether you will be a slave to your myofunctional therapy homework. See you guys next time. Bye-bye.